In the spring of 2020, I was having some hormone problems and eventually led to them wanting to do an MRI. The doctor, after my MRI, he said, well, we don't think you have a pituitary tumor, but you have a different brain tumor. It's an incidental finding. And he gave me the number of a surgeon up here in Louisville. He does not work for UofL, but he looked at my scan and he said, I can't do this. And he sent me to Dr. Williams. Immediately, Dr. Williams put us all at ease. He was my fiance at the time, actually said, you talk about brains like I talk about car parts. And Dr. Williams said, well, I'm about as comfortable. And that really put me at ease.
Anytime a person is evaluated with a vestibular schwannoma or a benign growth of the balance nerve, they need to see a specialist in ENT and they need to see a specialist in neurosurgery. Ideally, those people need to work together as a team with other providers like audiologists and rehab specialists and radiation oncologists to come up with the best plan for that patient to accomplish the goals that they have. And so Sydney's goals were very specific. She wanted to try to preserve her hearing if possible. She also had a wedding coming up. And so you really need to take into account what a person needs and wants out of their treatment in this case in order to give them the best.
So he kind of let me pick the timeline. He said, you know, we can do it now or we can wait a little bit. And I said, let's do it now. Let's go ahead and get it out. It was awesome to have a team that could cut up with us and make my stay enjoyable. They constantly checked on me. They constantly loved on me. I was so worried about my hair, and one of the members of the surgical team had it French braided around my head and tied with a tourniquet whenever I woke up. It was amazing. After the surgery, I was actually kind of shocked. I don't know if I thought that maybe I would just get up and walk off the table and be fine, but they had to sever my balance nerves.
The location where the tumor is where 4 nerves run together as they come from the brain out to the ear. So there's 1 hearing nerve, there's 2 balance nerves, and then there's the facial nerve, which controls movement of the half of the face on that side. Whether it's radiation or surgery, there are effects on those 4 nerves.
So it impacted my ability to walk, I was constantly dizzy, and it also impacted my fine motor skills. They had me do an outpatient physical therapy and an occupational therapy. 2.5 months after my surgery, I actually did a Spartan race with my friend Kristen. I didn't know if I would be able to do it. It was an obstacle run through the mud, a 5K race, and it was a little slower than what I would usually do, but I still crushed it. This past year has been more amazing than I could ever imagine. I think it's crazy that I think of more good things than bad things. I cannot speak enough good things about the UofL Health teams. I had Dr. Williams and Dr. Lynn, but I know they are everybody at UofL is just as good as they are.
At UofL Health, we've created a 24-hour policy for any new brain or spine tumor referral. This helps to ease anxiety and expedite next steps quickly. If you are a patient that has been called with new abnormal brain or spine imaging, have your provider contact our direct line and you will be seen within 24 hours of receiving that referral.